Welcome back to The Listening Doctor. I'm Dr. Sowmya Josyula. Today's episode is part of our series, The Question Behind the Question. And the question we are exploring today is one every doctor hears, sometimes many times a day. Is this serious, doctor? When patients ask if something is serious, they are often asking if they are going to die. Fear drives many consultations more than disease. Let me tell you a story. He was a 30-year-old, a busy corporate lawyer. He worked nearly 12 hours a day, often more. Sharp, articulate, well-informed on paper, he is low risk. Emotionally, he was not. He came in complaining of chest pain. He described it carefully. Pain on and off, sometimes while working, occasionally while walking. The description sounded concerning, almost typical of angina, and yet something didn't fit. He had no risk factors, no family history, no chronic diseases. Still, he was very clear about what he wanted. He said, "Doctor, I would like to get blood work, an EKG, and an echo, maybe even a stress test. I want to see a cardiologist. I just want to be sure everything is okay." As he spoke, I felt that familiar tension every primary care physician knows. Am I missing something serious? Should I just order everything? But what caught my attention wasn't just his symptoms, it was his urgency for reassurance. As he explained that these symptoms had been happening for years, something stood out to me. If this pain had truly been ongoing for years, why now? So instead of jumping to the test, I paused and asked gently, "What made you decide to come in today?" There was a brief silence. This open question uncovered the real trigger. A young colleague in his office died from a sudden heart attack. He didn't have any chronic diseases, no family history, and the entire office was in shock. And suddenly his question made sense. He wasn't asking about chest pain, he was asking, could that be me? Sudden death feels unpredictable. When someone dies, someone similar to us dies suddenly, our symptoms take on terrifying meaning. Testing feels safer for most physicians, but in low-risk patients, it can increase anxiety through false positive tests. Because chest pain and fear equals testing. But here's the uncomfortable truth we don't talk about enough. In young, low-risk patients, testing can create more anxiety. An EKG in a healthy patient may show non-specific changes, variants of the normal, findings that trigger more tests and more fear. And suddenly, reassurance turns into a spiral. So instead of reacting to the symptom, I chose to respond to the emotion. I looked at him and said, "It sounds like you're worried this could be life-threatening." That was it. No statistics, no dismissal, no don't worry, just naming the fear. And immediately I saw his body change. His shoulders relaxed, his voice softened. He said, "Yes, exactly. That's what I'm scared of." Only after that did he ask, "So what should we do next?" Now we could talk medicine. I told him the truth calmly and clearly. I said his symptoms were real. They deserved attention. But the pattern and duration didn't sound typical of angina. I explained the probability why sudden death events in young people feel frightening, why they are unpredictable but still rare, why tests can sometimes mislead more than help. So we agreed on a measured plan, a basic health checkup, lifestyle review, clear safety advice, and I told him If you ever have a chest pain again, go straight to the nearest emergency room. They can check your cardiac enzymes and an EKG immediately. That plan gave him something even more powerful than tests. He left saying, "I feel better knowing I'm in safe hands." He left not because all tests were done, but because his fear was addressed. Here's the lesson I want young doctors to remember. When a patient asks, "Is this serious?" they are often not asking about the pathology. They are asking about mortality. Reassurance without addressing fear doesn't work. Testing without understanding the context doesn't heal. Your job isn't to just eliminate all uncertainty, it is to walk patients through it and with honesty and presence. When you answer the question behind the question, patients don't just feel reassured, they feel held. In the next episode, we explore when reassurance, not investigation, is the real request. Until then, take a deep breath. Bye.